Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, April 21st, and this is my daily briefing. First, I just want to give a little shout out to Mary. I just want to say thank you for the beautiful card that you sent. That definitely put a smile on my face yesterday. It was a very long and busy Monday, so thank you. So as of today, we've had a total of 41 cases to date in Missoula. 39 of those cases have been identified by testing and 2 were epi-linked. We have 26 cases that have recovered and we've had 1 death. The state has had a total of 437 cases and 11 deaths. So first I want to talk a little bit about businesses reopening. I just want people to know that our health department here in Missoula is thinking ahead about what a gradual reopening would look like if the governor decides not to extend the stay-at-home directive. We don't know how the governor's strategy will unfold or the local considerations that our health officer will likely need to take into account. However, our environmental health division is working through ways to support the businesses in Missoula while protecting employees and the community. We know that things won't be back to normal, but we want to be prepared for at least that reopening. Our environmental health group has been reviewing guidance and drafting plans, and they're also engaging partners and stakeholders from within our community in order to get feedback on their proposals. Environmental Health hopes to issue some guidance midweek, and our department will have more for you in the coming days, so stay tuned for that. Next, I want to talk about the testing center. I just want to remind everyone that our COVID-19 drive-through testing center is taking any Missoula County residents or healthcare workers or first responders with symptoms of COVID-19. That is a free drive-through testing clinic. If you have symptoms of COVID-19, please call 406-258-INFO. That's 406-258-4636 and select option number 2. That will get you through to a nurse and you could qualify for getting an appointment for free testing. I want to talk a little bit about our updated recreation guidance. We've had people express concerns about COVID-19 spread and how people are recreating in our communities. Physical activity helps support a healthy body, but it's still important to think about ways that you can protect yourself and others from exposure to COVID-19. Just because you're outside doesn't mean that you can't get or spread COVID-19. So here are our recommendations for healthy recreating. Do not meet up to recreate in groups. Please go solo or go with a member of your immediate household. If you are recreating with friends, then you really need to pay attention and maintain that 6-foot social distancing. The social distancing should be at least 6 feet between you and other people, and the more space between you and someone else, the better. If you've been quarantined for travel or exposure to COVID-19, please do not recreate. You need to stay at home. If you have been asked to isolate for illness, please do not recreate until you have been released from isolation by a public health nurse. If you have symptoms of COVID-19 like fever, coughing, or difficulty breathing, please don't recreate. Instead, contact a screening center for testing. Avoid trails and areas that are really crowded. If you pull into a parking lot and the parking lot is full or there are a lot of people on the trail, please choose a different place to go to a different recreation area or wait until the area is less busy. Please make sure that you always obey those leash laws and follow guidance from Parks and Rec, state parks, or the Forest Service. If an area is closed, please respect that and find another location. For the safety of parks employees, some services may be limited. So don't leave garbage behind. Clean up after your pets. If you pack it in, pack it out. Remember that the restrooms may be unavailable and there may not be places where you can wash your hands. So please come prepared to clean up or sanitize before you touch anything. If a direction of traffic on a trail is specified, please follow it. And all of these guidelines go for kids and the younger crowds too. Just because you're young and healthy doesn't mean that you can't get COVID-19. And so social distancing is still required. You can still shoot hoops solo, but please don't go play sports in a group in the park. Postpone play dates with kids that are outside of your immediate household. It's just really important that we continue to try to maintain social distancing, even when we're recreating and trying to get outdoors. So the next thing I want to talk about is a sleepy inn. We've gotten a lot of questions about the condition of the sleepy inn And before I dive into the specifics, there are a few things that you need to understand about inspections. The first thing that I want to point out is that inspections are a snapshot. Inspectors can't see every room in a hotel during an inspection. There isn't the time or the resources to do so. They inspect a sample of the available rooms that have been cleaned and are ready to rent out. Secondly, they can only observe the issues that are happening on that day. So if the circumstances are different from one visit to the next, or from room to room, or season to season, or manager to manager, the things observed are going to change over time. Third, routine inspections happen once per year. Something that didn't appear to be an issue at the last inspection could definitely be an issue, can appear to be an issue over time, and could rise to the level of concern on another visit. Our inspectors try not to see the same rooms each year to get a better survey, so it's harder to catch some issues which might develop over time. Another thing to note is that health inspections are based on limited regulation, and that has a much different compliance pathway than other types of regulated establishments like restaurants. So keeping all of those things in mind, the visit done by our department a few weeks ago was not your typical routine inspection. The visit was requested in order to figure out what changes would need to be made in order to bring the facility into compliance if the facility was going to be utilized as a shelter. It looked at about half of the rooms and partnered with other regulatory agencies like building and fire inspectors, which are perspectives that we don't typically have whenever our environmental health inspectors go out. Another difference is that we had several rooms that had been vacant and had been sitting for a while. This allowed water to sit in the pipes, leading to rusty colors, and it allowed for pests to take up residence. Rooms with more activity are not as likely to attract pests, so cleaning and maintenance happen more routinely, so the pest issues can be more easily identified. Also, rooms that aren't used can also get stuffy when vent fans are not opened and windows are not open. The guest laundry is not something that we regulate, and that room is often left open to the outside, allowing pest entry. The mechanical room is below grade, not a guest or storage area. I'm not saying that there aren't issues with this unit, but there are. But what I am saying is that this visit was just not a typical inspection visit. All of the issues will be addressed before that facility will be used as a shelter. Additionally, if there were any imminent threats to health or safety during this assessment, that immediate corrective action would have been required. As far as how this facility has been handled in the past, the health department has cited issues with cleaning, pests, and facility upkeep. They've directed the owner to fix the issues, as that is their responsibility to follow the rules. The department has followed up on pest complaints, including ones about bed bugs, and inspectors have verified the completion of pest control services. It should also be noted that the facility did undergo major repairs and renovations in the past due to violations. Engineers assessed the facility, plumbers were contacted, the connections were made with other regulatory partners. The result was significant improvements in cleaning, the condition of the facility, and pest management. While the facility is not 100% in compliance, measures have definitely been taken to improve the facility and its operation. The public should recognize that hotels often have violations, but the corrective action taken by the hotel is what's important. When this doesn't happen, the health department works with the operator to get compliance rather than using a heavy-handed approach. With a facility like Sleepy Inn, this method is essential, as regulatory actions could also lead to evictions of long-term renters. So I just wanted to make sure that some of those things got cleared up. I just want to say thank you to everyone in Missoula County for everything that you're doing to try and keep our communities safe. Please continue to maintain social distancing, continue wearing face coverings whenever you are out in public, like when you go to the grocery store or to the pharmacy, in order to protect other people from pre-symptomatic spread. Also, please encourage your children to avoid hanging out in crowds on the trails and in the parks. Let's just all continue to work together to keep the spread of COVID-19 manageable in our county and to protect those most vulnerable in our communities. So that's it for my daily briefing for today. You can, as always, subscribe to me on YouTube under my name, Cindy Farr, that's Cindy, FARR. Click that little notification bell to be notified whenever additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department. We post lots of very useful information there. Also, please check out our website at missoula.co/cvirus for all kinds of information and guidance regarding COVID-19. For specific questions or to schedule a free appointment for the drive-through testing center, you can call 258-INFO. That's 406-258-4636. And that's it for me today. Everybody, please try to stay healthy, get some fresh air and sunshine if you can. Just make sure that you're avoiding other people, and I will talk to y'all again tomorrow.